Beyond the trip, beyond the haze, we're lighting up these shadow waves. Ketamine dreams to...
Welcome back to Conscious Healing, Beyond the Trip, hosted by Dr. Jason Harris. Each week, Dr. Harris explores the world of ketamine and other psychedelics, uncovering how they're helping to treat mental health conditions and chronic pain disorders.
This podcast is intended for educational purposes only. The information shared should not be considered medical advice. Always consult with your physician or a qualified healthcare professional before making any changes to your medication or treatment plan. Please be aware that some of the substances and treatments discussed on this podcast may be illegal in certain jurisdictions. We do not endorse or encourage the use of illicit substances. Hello, everyone, and welcome back to Conscious Healing Beyond the Trip. I'm Dr. Jason Harris, your host. And first off, I want to start by apologizing for the hiatus I've had in recording videos. It's been quite a few months since I've had the time to record a video and keep you updated on the things that we're doing and what's going on in the world of psychedelics. But I can ensure you the reason I was taking the time off was to make your experience at our clinic better. Today we're going to talk about the new Texas Medical Board rules regarding psychotropic ketamine therapy, also known as PKT. These are the official regulations that govern IV, IM, and subcutaneous ketamine treatments when they are used for psychiatric conditions like treatment-resistant depression, PTSD, and suicidal ideation. This is a really important development because ketamine therapy is becoming more mainstream, and Texas is now putting formal structure around how these clinics operate. So today I'm going to break down what the rules actually say, who they apply to, what clinics now have to do, and what this means for patients and providers moving forward. So let's jump into it. What is PKT? Under the new Texas rules, psychotropic ketamine therapy is defined as low-dose parenteral ketamine used for psychiatric indications. That includes IV, IM, and subcutaneous ketamine. So the key point is that the patients must have a properly evaluated psychiatric condition diagnosed by a physician. The Texas Medical Board also specifically states that ketamine administration is considered the practice of medicine and is therefore subject to their regulation and oversight. The first part of the ruling is who has to register. It says most clinics offering ketamine therapy in Texas now have to formally register with the Texas Medical Board. There are some exceptions. Hospitals, medical schools, government facilities, and certain health organizations don't have to register, but independent ketamine clinics like Transformative Wellness and these other ones must register. The registration lasts for 2 years and requires a board-approved application submitted by the physician owner or medical director. I don't have an issue with that. We were already practicing under office-based anesthesia rules, which required the same thing. So we'll just see how that registration goes and how strict their monitoring requirements of those reapplications are. So the next part of the rules talks about physician requirements. This is a big one. These rules place a major emphasis on physician qualifications and airway safety. It says that any physician prescribing PKT must complete an airway management training within the past 2 years. Now, I don't know what that means. They've not defined what this means. As a board-certified emergency physician who intubates all the time, am I required to specifically go to a course to do airway training? Will my, intubations that I perform in the emergency department matter? Will an ACLS course that talks about airway training be approved? I don't know. They've not expanded on that, so we're not quite sure. The next part says that the physician must have either mental health treatment training, such as a psychiatrist, or ketamine-specific psychiatric treatment education, which I took prior to opening my clinic. The physician must also establish a proper physician-patient relationship. This is the key that is going to harm a lot of ketamine clinics that are out there. A lot of ketamine clinics don't have a physician that comes into the clinic and sees these patients. They're all staffed by a mid-level provider, such as a nurse practitioner or a CRNA or a physician's assistant. So that's going to be financially harmful to some clinics because now they're going to have a physician come and see these patients. They're going to have to pay that physician for their time. That physician must document the psychiatric diagnosis and justify why ketamine therapy is appropriate. This is clearly designed to prevent casual, poorly supervised ketamine prescribing, which we are seeing all the time. The next part of the ruling says who can administer ketamine. It says the rules allow ketamine to be administered by physicians, CRNAs, nurse practitioners, and physician's assistants working under the delegation of a physician. It talks about monitoring can also involve registered nurses working under physician supervision. Importantly, all of these providers must also maintain airway management training. This reflects the fact that ketamine, while generally safe in experienced hands, still requires appropriate monitoring and emergency preparedness. I don't disagree with those rules. We have seen numerous patients who've come from other clinics, and the prescribing practices and the treatment practices from those clinics do not follow the typical published recommendations. The next part is supervision requirements, and this is huge. This one specifically talks about the operational changes and how many clinics a physician can supervise. It says the physician must either be physically on site or immediately available through two-way audio-visual communication. And this is the big one. And they made this change. Whenever they first put out the recommendations, they initially said a physician must be on site at all times. Now, they did lessen this a little bit, but they did talk about that if there's an emergency, the physician must be capable of arriving on site within 30 minutes. So if a physician is monitoring or supervising more than one clinic and there's two emergencies, they wouldn't be able to arrive within 30 minutes if those sites are too far apart. And that leads me to the next point. The rules also limit how many clinics a medical director can oversee and how many delegated providers a physician can supervise. This is clearly aimed at preventing large, loosely supervised ketamine chains from practicing in the state of Texas. The next portion of the rules talks about adverse event logging. It says clinics are now required to maintain formal adverse event logs for at least 3 years, and this includes any event involving airway intervention, EMS transport, hospitalization, or death. It says the logs must include patient name, date of the event, type of adverse event, and outcome if known. This creates significantly more accountability and traceability for clinics. I don't have an issue with that one. We're already doing that. We keep a track of all of our patients and if there's any issues. The next one I do have a couple of issues with. It's about the monitoring requirements. It says the monitoring standards are actually pretty substantial, and I can honestly say that at Transformative Wellness, we're already following all of these. It says patients must have continuous monitoring of blood pressure, pulse, respiration, oxygen saturation, cardiovascular status, and responsiveness. It says the monitoring must continue both during and after treatment. And this, basically what this does is this pushes ketamine clinics toward a moderate sedation style safety model. Again, these rules were written by an anesthesiologist, and they are reading into their background, and that's why they've implemented these. The next part of it talks about patient limits, and it says the rule limits how many patients can be simultaneously treated at the same, during a session. So if a physician is physically on site in the clinic, then providers can manage up to 4 patients at a time. If the physician is not on site, providers are limited to 2 patients at a time. And the rules also specifically say that someone administering ketamine to multiple patients cannot also be the sole monitor for those patients, which means that you're going to have more staff in the building to monitor these patients. And that's a major workflow consideration and a cost to these clinics because they're going to have more overhead with more staff. The next part is recovery requirements, and this is one that I had to extend my monitoring by a short period, but really not, because by the time we get them unhooked and everything, it's been that amount of time. So after treatment, patients must complete at least 30 minutes of observation. Currently, we were doing 20 minutes. No problem. We'll just increase it by 10 minutes. We have to do 2 blood pressure readings 10 minutes apart. We were already doing this. And this is next part's a new one. Again, is something that is done by anesthesiologists at a surgery center or after surgery, and they want a full cognitive assessment, including an Aldrete score, which is basically just a list of things that we have to check. Are they back to their normal alertness? Are they awake, alert, and oriented? Are their vital signs back to normal? And that kind of stuff. So not that big of a deal, but one more step we do have to complete prior to a patient discharge. And then only after the patient is fully recovered can they be discharged. These rules are focusing heavily on patient safety and documentation. The next thing is required equipment that clinics must maintain. They have a list of emergency equipment that must be on site at all times. Again, I already have most of these. I do have one issue, and I'll go into that in a second. They want us to have oxygen, bag valve masks, an AED or a defibrillator, and this final one, an end-tidal CO2 monitoring equipment. That's the one I have a big issue with. It doesn't specifically say if this has to be an electronic end-tidal CO2 or if this can be a colorimetric end-tidal CO2 like we use after we intubate somebody to ensure that the endotracheal tube's in the right location. I know that these questions have been asked. I'm not sure. We've not seen a specific recommendation on this, but I can tell you that these end-tidal CO2 monitors, if it's an electronic one, are not cheap, and it's going to be a hefty purchase for a lot of these clinics, including mine, if that's required. They require continuous pulse oximetry and blood pressure monitoring during the treatment. Again, we're already doing all this. And all of this is another example of ketamine clinics increasingly resembling procedural or sedation environments. The next part of the requirements are informed consent, and it says specifically the patients must be informed about the known risks of ketamine therapy, the credentials of the person administering the treatment. That's big. I don't know if you know when you go into a clinic who's actually giving you the medication. Is it a physician? Is it a nurse practitioner? Is it a registered nurse? Who's giving it to you? So that's a big one. Clinics must also perform a timeout procedure before the treatment. So you'll have to verify the patient's name, their date of birth, and you'll have to verify, the dose that they're getting. We're already doing that, not necessarily document it like it's required, but we are doing that in our clinic. And the final one is they have to maintain complete and contemporaneous records. So all of this is going to have to be added to the medical record system to ensure that everything is being performed, because the state will come in, the state will audit you, and if you're not doing these things, they could pull your license. There are some special requirements. This one is pretty big for me, and I 100% disagree with the wording on this one. And it says that women of childbearing age must have a same-day pregnancy test. It's required. They say it's required unless pregnancy is medically impossible. So my biggest concern with this is, one, why do I need to do a pregnancy test on someone who's on their menstrual period, right? We screen them, we ask them, is there any chance you could be pregnant? I feel like there should have been wording in this that allowed for patients to opt out, to sign a consent to say they're not pregnant. Now, obviously, if somebody tells me that they're sexually active, they're not on any birth control, and it's been a month and a half since they've had their cycle, I'm going to do a pregnancy test, 100%. But the patient should have the opportunity to opt out. I think I've talked to a couple of friends of mine who own ketamine clinics, and they brought up a great point. What if a patient is coming to see us because their depression stems around the fact that they can't get pregnant, and then we require them to do a pregnancy test? So we're just throwing it back in their face each time that they come in for a treatment. I have a big issue with that one, and I think there's a lot of other clinics that have a big issue with that one. So we'll just have to wait and see what the clarification is on that, because I know it's been asked. Physicians are also required to review the Texas Prescription Monitoring Program when we establish their care, so at their first visit, and then at least quarterly for ongoing patients. I don't have an issue with this one. I think it's a good to know what medications, and that prescription monitoring program lets us know if a patient is on another medication, such as Schedule 2 through 4 medications, Schedule 2 through 5 medications, such as pain medicines, benzodiazepines, and that kind of stuff. So I don't have an issue with that one. It's in most medical records, a quick, easy, you just hit a button, pops up with what medications they've had filled over the last 2 years, and you can go through it and go over it with the patient. The next part of the ruling talks about what is prohibited. And it says the rules specifically prohibit administering ketamine outside of a registered clinic and prescribing ketamine for at-home use. And that's an important distinction because these regulations apply specifically to parenteral ketamine therapy. So this does not cover at-home ketamine therapy that you would get in the pill form or the lozenge form. I'm sure a lot of people who are watching this have researched ketamine and they've seen companies out there that are online companies and they prescribe this. What this will do is this will specifically prohibit companies like MindBloom from prescribing at-home injection ketamine, which is 100% absolutely ridiculous and should have never been allowed in the first place. So I applaud the Texas Medical Board for this. I do wish that they had banned all at-home ketamine therapy, including the troches and the lozenges and the rapid dissolving tablets, but they didn't go that far. Alabama did, but Texas did not. So my final thoughts, overall, these new Texas rules represent a major shift in how ketamine therapy is regulated. In many ways, it's legitimizing ketamine therapy as a serious medical treatment with defined standards of care. But at the same time, it raises the operational bar significantly. Clinics now need stronger documentation, better monitoring systems, and more formal physician oversight, and improved emergency preparedness. So I think that high-quality clinics like Transformative Wellness that are already prioritized patient safety will adapt well. I only have to add a couple of little things to mine. No big deal. I will do just fine, no issues. But I think clinics operating without strong medical infrastructure and supervision are going to have a big struggle under these new requirements. They're going to have to find a physician to see these patients before they come in for their first treatment. They're going to have the prescription or the order written by the physician, and they're going to have somebody on call every time they're giving these treatments, and that's going to be a hefty cost to some of these clinics that they can't afford it. So I do think this is going to shut down some clinics, but at the end of the day, these regulations are really about one thing: patient safety. Honestly, that's something everyone in this field should support. Thanks for watching, and if you found this breakdown helpful, make sure to like, subscribe, and share this with anyone involved in ketamine therapy or mental health treatments. Stay tuned next week where I'm going to discuss a big topic that is something that I'm very passionate about, and that is kratom and why it should not be legal. As always, stay curious and stay informed.